is all about recoveries. We'll be visiting our beneficiaries and catching up with their recovery progress. Hand in hand, we'll watch them take their first steps toward restitution, towards a hopeful, pain-free life. We will be talking to a doctor, a specialist actually, about stones. Yes, literal stones in our urinary tract. This show is brought to you by Vodafone. Further together.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Coming later in the show today, we will be experiencing some fitness with our hearts pumping with Afia. But before that, let's bust some myths. Wow, so do people do that though? With all that blood? You are the guy, tell us. Mojano, you're getting some. Okay, your look tells me all.
You see, this is a very sensitive topic. I don't want to talk about it.
Okay.
But all I can do is, I want to not comment about whether people do it or they don't do it. Because we need the legacy. It has my means stay clear. We can stick to the health part of it, and then do our job.
Yeah, talking about that, is there any truth to you being infertile during your period?
Okay, so Fema, I think that maybe if we understand how the body cycle works, then we will see where the most likely periods are, where you can't get pregnant, and where you are not likely to get pregnant. And my emphasis on not likely, because in medicine we say never say never. Right.
So the bones are what?
Exactly. So
on your phobia.
I know, right?
Yeah, medicine. Anyways.
All right. So the period begins, let's say, from the first day that you see your first menstrual flow. Okay, so that would be counted as day one.
Okay.
And depending on your personality or depending on all kinds of circumstances, people have different durations for which they bleed. So day one would be the first day, and whatever day that the period ends would be the end of that phase. Now, when the blood is coming, it means that the lining of the womb, which had been made ready for pregnancy to implant in, it didn't come on, and so the body naturally would get rid of it so that a new lining will be formed. So during that period, say for 5 days that you bleed, 7 days that you bleed, that ends that cycle. Then after that, the ovaries begin to release an egg. Okay, usually by day 14, from the first day that you started bleeding, you would have released an egg from the ovary. And this egg will be traveling down from the ovary, down the tube, into the womb. Okay, so by the time the egg gets there, the lining that was shed should have started to grow again, ready to receive the egg that is coming. So by day 14, when the egg is released, the lining of the womb should have also grown back, another lining, so that in case there's fertilization, it will implant there. If, however, by day 14, the egg is not released, then during that period, there's no egg, so you are safe all through that period, until it is time for your cycle to begin again, or for what has grown to be shed again. That period varies depending on whether you are 28-day cycle person or 31-day cycle person. So as a rule of thumb, day 1 to say day 7, you would bleed. After the bleeding, the egg is being formed and being released. By day 14, it is released. Give yourself 2 or so days before and after. So from day 7, when the bleeding stops, till about day 12, the egg is being released, or probably has not been released. You might be safe. But from day 12 to day 14, when you might actually release an egg, and 2 or so days after that, say from day 12 to day 16, is not very safe, because by that time you expect that an egg has been released. But usually by day 16, 17, the egg would have expired. It will not be viable anymore. So after that, till the next day when you start bleeding again, it is safe.
So you mentioned the safety net, and it doesn't include the menstrual 7 days. What happens during that time frame?
So just like Abba is saying, so she says, let's say about 7 days. So in that time, from day 1, it started counting. So if you bleed for 10 days, which sometimes occurs, you may have a prolonged bleed for whatever reason, then if you're sort of like me, waiting for the menses to stop before...
Did you say like me?
I didn't... Did you hear that?
Yeah.
If you are waiting for the menses to stop before you
Yeah.
then
start counting. Yeah.
you means you have just like 2 days. And if it moves a little bit, because the sperm too can last for about 3 days. So if you go in when you have just about 2 days going, you say, okay, today is day 11, so Dr. Abba says 2 days, so I can push it in quickly and then nothing's gonna happen. You go in at 11 days and then your sperm stays long and meets the egg as it's being released. Then again, sometimes during ovulation, you may see some blood. So the thing really is to be able to ascertain that the bleeding you're seeing is menstrual blood. Also, in the wake of emergency contraception these days, when you take emergency contraception, you can alter the cycle. When you do alter the cycle, the bleeding becomes irregular. Now, distinguishing which was your menses and which is not the menses may be a little tricky. So if you assume that what was not your menses is your menses, and then you have sex at that time, you can imagine what that could do.
Okay.
So I think that we never say never in medicine, like Dr. Folsing said. Knowing the cycle, she's giving a long lecture as how the cycle works, day 14.
Yes.
She's trying to make us understand. If you're a woman in your reproductive age, you want to go and read more and consolidate this knowledge. So also understand one cell body.
Exactly.
Understand your body so that when you're ovulating, you should be able to know, ovulate. I did try be ovulate. My temperature ovulate. You should know these things if you're trying to use this as a form of contraception. You see, so that you don't just use the blood. Okay, so because you're not sure which one, then once there's blood there means I am safe. It may not necessarily be the case. So a few things do.
Yes,
and
the last and rather important thing to note is sometimes a conception would have taken place, but not in the uterus.
Okay.
So it's an ectopic pregnancy.
Okay.
And you might bleed during the time that you're expected to bleed, but you've already taken a seed and it's implanted somewhere else. So it does not really mean that you are not pregnant or you cannot get pregnant. But like he said, I think you should know your cycle. And if you don't want to get pregnant, then do the needful.
Do the needful. Do the needful. Like Vodafone Healthline has been doing the needful for the past few weeks. We've been bringing you their stories. We have shared in their pain. And we have seen them at the lowest moments in their lives. It's time to see them restored, to see them go back home to smiles, to laughter, to embrace. It is time to see them take those steps, starting a new chapter in their lives.
Enjoying Bena Afanti Elisha Elena Mobile no chicken. Miji Gamimo Poga.
Mi okaka mi chakaka bo mi mo pokona moto fika mi mo cho.
Akpana Vodafone to be azinia Elisha tete kwa babaji okpere nyanchi owenemi.
Yova wonam jidonpa.
Le jibo konji yo wo place na de vianu le nchi fafa mo. Edo jidwanu le nya gbomo. Akpana ma wona yiro kaka.
Isi ade via gbova musan lo si. Ala nu du nde ko pe ala won.
Jijoro la monu mo le nu du. E vinya cha le nu du te bo nu mo yen gba to nu du la pada ka to ni jijo le la monu be.
Ku kafu kun de sia mawo tono le mawo molo.
Akpana Vodafone to.
Akpalo.
Efrem Kate from Afia West. If I show me bani Jeffrey, bra me wo Jeffrey no yare. Nti doctor me ya say be no operation. Na Jeffrey baby a odwon so fa no. Na doctor say e ho no asi. Nti operation na Johnson ntimi mba kese se de se eba. Sisi ade nyame adom. Johnson no etimi eba. Mo kwaso ada Vodafone for ase. Esan say me operation na omokoye me ba no na aye critical necessary ye na animu na na etu ye ne ni da so kra asa eska sem nso nyina ye den na Vodafone 40 ye nka nti omo bebo aye ema operation ne course nyame adom sisi a operation ne ewie ye no Jeff ahoden aba no tibiem ese ne tibia na asesa every said they know what face no. They said in Yami and Dom no ye.
Vodafone for Edamase. Yamin Shiramo. Yamin Mamo Paten.
Mama won no mention wahala. On some being one corner papa.
Ko boy sem fie yensan ko nan no. Na fe chas ohon mo na na fu na he kakada o sa na fu a he kakada kile na
Emwana Vodafone for the bebo a Charles no nyame adom bibia wie Charles ho ato na nije abafie
say Charles wetimi ko school wetimi ko toilet wetimi didi pa wetimi da wetimi tumiri ka bobol bia say no ato ani ji abefie say me no mo ka say mani age pa mu mani age pa me di aseda PSA efiri nyankopon edima Vodafone for ni asko doctor for nyina
nyame hiro bia o mo hwe akwara no ma me
ti Vodafone for Edamase nyame hira mo pa
Vodafone for Edamase nyame hira mo nyina
Grace yare no say nyame adom. God afọ madaro ma mo be mo no. Say yare no ano abrase. Ente sa first no. First akakra no ko hospital no. Ti doctor no so be mo no. Baby aba normal.
Me da Vodafone fon ase e wo mo akese o ma ya ama me. Sese mitumi bu mensa. Meni so na ebiri me ni nyina sese ni nyina agyan. Mitumi kwa adwuma, mitumi ya na mentimi nya bia. Acho Vodafone fo aye bebre ama me. E wo me yarwe mu, o ma nja me, o mo boa me. Nti na me kan se nya me nhira Vodafone fo. Nya me nhira wo mo nya wo mo kese.
Oh, dem person catch Vodafone say nya me nhira wo. Ewrade ma wo matabem. Na mo anu a wo mo wo ma foforo no. Da wo mo nye na ewrade nkoso a no nhira wo. Nti ya da wo mo ase bebre anepa wo mo aye aba me na me ba Grace abrabo.
Vodafone fo me da mo ase o nya me nhira wo mo akese a mo de aboa mo mabrabo mu nti mitime ya nya mentime nya bia nya me nhira mo.
It's so refreshing.
You know,
it's so refreshing.
For us in the health sector, I mean, what's tell heaven? That one is there. But to see people that hitherto were not well and are better, because for me, based on my belief, I would say God has used you in a way to help them. It's actually very, very, very rewarding. I mean, it's been an exciting for families that have received help. It's been sad for some of the revelations that people have had to deal with. You know, remember our little boy, the one with the
kidney.
The distended stomach. Yes. You know, with everything that probably could have been going on. The stomach is going to eventually calm down as he grows and everything falls in place. All the flabby tissues are going to fall in place nicely.
Did you say inflammatory tissues?
Flabby. Anti-inflammatory.
You know my ears are all
anti-inflammatory. And so yes, all the flabby tissue is going to, you know, come down. Then you know everything's going to pick up nicely.
That's nice.
It's good to also know that our best friend,
Victoria.
Oh, Grace.
Grace.
So you see, I think you realized during that episode that I was a little bit passionate about what she went through and the psychosocial trauma that comes with. Sometimes we think of help in the medical sense, maybe some surgery or chemotherapy, but help comes in the form of psychosocial support. Even when you may not be able to do something too drastically, the counseling, the encouragement, the support goes a long way to keep people, mind and soul together, our body and soul,
and healthy. What's it? WHO states that health is not just the absence of disease or infirmity,
but a complete
social, mental, physical, emotional. You know, this is a financial. The financial account.
Oh no, yeah.
Because the financial account because Charlie.
Oh no, yeah. The money is so be healthy.
Hey, who tell you? Someday.
I would just want to comment on Victoria. I remember about mentioning that at her age and the persistent bleeding and the pain in abdomen, not sleeping for 2 years. Maybe the sleep, not sleep it in the you know, but I can imagine that kind of pain. She has to definitely do check for cancer, and it came out that it is cancer. And when you have a diagnosis, you know what to do, and now she's going to get that treatment she needs. And finally get some Z's, you know. Be able to sleep, and for me that is refreshing.
And you know, Abba mentioned again chemotherapy.
Yeah.
You know, so when it comes to cancer management, it's not just surgery. We're happy if we can do surgery. Now, to do surgery, we need to have a localized disease, such that when we take it out, we get close to cure. If there's anything you're not sure of, any growth, anything, report early. I keep hammering on report early because I can't overemphasize how early contact with the health service can change the course of a disease process. If on the other hand, you, for some reasons, are unable to get to the health service early, when you do get to the health service, whatever options are given you, read about them, ask questions, and I'm inclined to encourage you to take them because they have some benefits to improving quality of life, to improving reducing disease progression, and generally, you know. So if it's chemotherapy, so a radiation, so a surgery, let's say cancer, it's hard.
Yes.
You see, it's hard. I mean, when I come into contact with cancer patients, they be on a ward but even say a surgery lister, cancer it's at the next immediate available. Once you are ready, we don't put you in a long wait list. No, but also cancer is cancer.
You can't wait.
It can't wait, and it's time bound.
Yeah.
I'm happy she's receiving some chemotherapy, and I hope that will bring us some improvement and the quality of life will be better.
Honestly, cancer treatment in Ghana is getting better and better by the day. And I'm just grateful, ecstatic, and it's so refreshing to see a maintenance culture right in front of our eyes. Vodafone Healthline, 10 years, it's been amazing. It's going to continue to be amazing. We'll be right back.
Afia, who bet me your quenyas from ko aye nije ye power Vodafone so. Ye the data bundles are any seso Ghana ha bro. Ye more die so. Ye ni da so nyina bem. Enti baka ye ho, nya data mo ni je power bebre.
Vodafone, further together.
We are about to discuss our kidneys with Dr. Akpakli. You can find him at Kolebu Teaching Hospital. And what exactly about our kidneys are we talking about this time? Stones, yes. Abo ankasa to me about kidney mu. Never ne sign abo to me call kidney mu. Why we abo bi ana say who did na say abo dem now yi wani. Who say to be na nyawo dem no yi wani no aria am ni so aguso. Enema abo ne ba kidney mu ana say bifufu. Well, like I said, Dr. Akpakli will be telling us more about that. Doc, welcome to Vodafone Healthline.
Thank you very much.
So, Doc, is it really kidney stones, like stones in the kidneys? One, are they real stones? And two, are they from the food? You know, sometimes you just chew the sand, like you just bite into a stone, like, but then you swallow it anyway. Are they the causes of kidney stones?
No, they're actually not the causes of kidney stones.
But
are
they stones?
They are stones, they are real stones.
Hey.
So, let me just start off by saying that if we talk about urolithiasis or kidney stones, they are stones that are found or produced in the kidneys, in the ureter, and in the bladder. Okay.
Kidneys, ureter,
and the bladder. Just as we can see on the screen, we have the kidneys, and there are stones in the kidneys. The ureter is the tube that actually connects the kidneys to the bladder. And stones can be found in any of these organs. So everyone at the cry idea about but I say a punsio, one say in Chini.
Yes.
Osa edisi hodna area bosswa. Oban say in Chini will start coming out. So basically it's the same thing. So it is the salt that is in the urine. Enti efie aduane ayedi. Enti nkrofo wo ha omu nwe aduane wi a no mo say in Chini afra. So adding salt to your diet, excess salt, will lead to kidney stone formation. But I did ultimately a born by panisa and crofobia hormone. So once you don't drink enough water, you are likely to produce evaporating. So it's going to become concentrated until Johnson will be produced, will also be concentrated. But baby, once I had me,
yes,
we sweat a lot, walking about, not drinking, and also maybe because of the work I had until we be
busy,
sir. I bet me the ababa. Now, microphone a lot of animal protein.
To say
mujanam, like ninchienam, aponchinam, bebre in excess. And also preconam so I bet me the
chicken.
Didn't you know animal protein? Yes. Good. Then you will never be sure what juice on them and microphobia they excrete a lot of it. To say be a calcium. So we term it as hypercalciuria and microphobia only a lot of calcium in their urine.
So by Johnson calcium
okay. And now oxalates and now uric acid.
Okay.
Some microphobia they are predisposed. Now microphobia forming oxalate stones. Microphobia do a lot of cocoa products.
Oh, cocoa
yeah, but if you take it in excess,
okay.
Yes, it can lead to stone formation.
In excess, cocoa excess.
Excess.
And now mojanam excess.
Debris.
Pension. Nah.
And also count. Yes, very good.
That majaba kwana.
Ebi will have messing work out. Okay, now make I say microphobia they excrete a lot of products from their body like calcium, oxalate, and uric acid.
Yes,
then good. You will other disease condition like diabetes.
Oh.
And gout.
Gout here then.
Gout here, diarrhea. Microphobia almost a lot of uric acid in their blood. Into uric acid na here a deposit in the big joints. So they tend to complain about pains. The toe joints.
Okay.
Typically, that's where they feel the pain. And they tend to excrete a lot of uric acid in their urine.
That uric acid, and they free mojanam nimunana.
Okay. And they want microphobia wants a sedentary life. For some reasons, like when you have stroke or the pain and when you spinal injury.
Okay.
Some microphobia they are predisposed.
Oh.
Then in mutanya recurrent urinary tract infection. Almost saying they form infection stones. Yes, so we have some stones known as infection stones. Yes. Inti sanyame enedi stones iba. Then the mire fear excess vitamin C. COVID by vitamin and nom say
drink bino.
Good. If you take more than 1 gram in a day, you are at risk of forming kidney stones.
Dog 1 gram no kind no. Sa vitamin C near Tony de 2 so muna. Kasia pa na ye say fanta no near no no. And only 1 gram ba ko pe. 1 gram.
Yes, 1 gram.
Ana ma cho ho say 1 a day. It's minimobi. I see on so no. We are saying that no day. Why?
Oh, your hand. Enche. Obeba kolebu.
Vitamin C supplement.
Make a mixture.
That's it. Doc. The okay. It's me and Kwala. And I say mpanyifo nko a ana nkokora nembrewa.
Kidney stone eye obia fitting nkora ekosi the very elderly.
Sir?
Yes, the youngest person I'm operating on is 6 years.
Hey.
Yes. And
6.
Yes, 6 years. All kidney stones. We want to say your family predisposition. In microphobia, almost kidney stones disease in your family.
Ow.
Until a sister now, within a bit more or 2 years, no, when you have kidney stones, it happens in children as well.
Good.
Na
oka stones na we dem my bisa ni oka said say abo pepepe ti say abo na me who said that form ni bia na
pepepe bio ti say picture here ye display say no enen kire ebobo a e wo kidney mu we one of the patients that na ka ye no operation nti sa pepepe na ebobo na ti nti wo ni say ebobo a e wo form
how the boy ba kinkrin
pa
wow
nti say no wo ba ye die hu say Who kidney stones. Inti typically in microphone kidney stones, they have severe pain.
Some make say be
Sa pain no like it's unrelenting in a sense that on a chrono yen who share ye. O kajen so antenas on to me internase. A benes on general under her but nina on to me. Inti one of the symptoms severe pains or flank. Baby a kidneys ni wo. Nchemusano. Ena ebi mu nso wo ha se pain ba omojun so be hu se moja wo jun so ne mu.
Akotitwi bibi.
Yes, because ebu ne wo ho no won say urethra na contract say e push eboba no. Nti esa ne nyina no e cause trauma to the urethra. Nti esa no be hu so no kro no jun so a moja wo. Na eboba no so wo ha se cha ono kro no do infection let me eboba ba. Ba eboba no wo ha no nso a e betimi ama infection. Asa
na yes, that vicious cycle.
Inti sa no obe hu so no kro ntem bia obeko hospital with urinary tract infection. We just scan obe hu say ono kro no wo stones. Ena e wo ho so a na wan nya ne hwe a e betimi a block kidneys no. Inti e block kidneys ni sa na obetimi anya kidney failure. Eventually you end up on dialysis. To say obi a me an operation ene ono or one kidney. Inti weekend ono mo de ne by wontimi junso. Ena o severe pain. Inti with that history nim say stone. Inti stone e ko block urethra inti ni kidney no junso na e producing na intimi mbafo. But nyame adum yetimi an operation na ni age. Yes, inti e ba ne sa nkrofo bi o say e bi o one kidney and now stones in blocky both kidneys. One of the symptoms is want to produce junso. Ube produce by intimi mpi. Enko juso to one ma be piaba. So that is also another thing we should watch out for.
Okay.
Then you want crofobia also or stone but yes, stones no it's not causing any problem. And TG say be on a chronic hospital. Then for another investigation be your complaint say on yemi and yana bibi no mo so kwatwa scan into kwatwa scanner incidentally we find say on a chron was stone inti sa no a oba na eja yabo modern ya so ano at the current I discuss kidney stones say it's now becoming an epidemic Ghana ha say kaneno na prostate operation number 1 say kidney stones operation number 1 obi a obebe bia o kidney stone ono kronya complain say bia nemfie na ya okotwa scan na CT kidney stones inti say no say ya hwe ya ebe haji pa
doc pachoka say operation kwa na ye treatment amode ma kidney stones and na say obi a for example enye ne fault ya wona to busuo mu kidney stones wo say na oka say ankwalai edro bi wo ho etumi bua prevent ade na na dissolve in ntemu na bibi wo ho etumi nane abo ya na bibi sa
emoba ne bi wo ho a ebetumi ane nane ba nya ni nyina
okay
de ebetumi nane a ebetumi ama wedru a ebe nane uric acid stones
okay
but other stones calcium stones oxalates or phosphate no and no say no obi ka so be ma wedru ama na nane a intimi nane
na infection stones na
infection stones so the cardinal thing is you need to treat the stone first.
Okay.
Then you treat the infection or prevent the patient from getting recurrent infection. But what normal antibiotics you are not doing anything. It won't solve the problem. Okay. And stones need be so depend upon the size of the stone. It won't hear say a operation. You bet me am withdraw relax urethra no. Na ama ebubana abasi but fortunately some of the patients they're able to pick it up and bring it. Then we send it for analysis. But say intimi ambassa, that means we need to operate. Na saying operations na nyese e betwa. Time na ye twa microphone for kidney stones e twem.
Sir?
Yes, say ye ntwa. Nti te say bia picture ya da screen so say no. E you be our forming stones e woni urethra no. Nti ye use laser machine and ye di break stone. Nti we have fine instruments betimi pass it across the urethra to the stone. Na ye use laser fiber to break the stones down.
Wow.
But the other modalities betimi use it to break the stones. You can even use ultrasound energy or another energy we refer to as pneumatic. But the munja my doctors. Yes, inti.
But I see at say muntrai.
Good, yenja.
Inti ensrobio.
Mamunstro. But any interest say you should go get kidney stones. But say stones ni sun pa. Laser no the area say it a dusty stone. A pine and getting into like a yes. But say you can't use a laser. And over down. So if the stone is very big, we have another treatment modality that we use.
Which is?
I friend PCNL, percutaneous nephrolithotomy. Yeah, and you say no yen child can any be child you be power baby. So say you bet you will think a crabby be say 1 centimeter.
Okay.
Na ye the camera shame near pair bobon to say picture here that's when it will be our former boba. One patient and yet patients me no na miensa.
Nipa ba ko
pe. And I will say operation say be say 5 hours and so na meet me. Nti ebi won but won say boba na say boba na e wo form the same thing. Yes. Yeah. Good. Nti so there are treatment options available that we use to treat our patients. So now your patients no want to crime you.
Yes.
Yeah, make I time na me wo program no as to become a consultant. Patients be 2010 so buy and neighbor they can see into me empire into onko South Africa na Egypt.
Oh.
But when him say me we asan ko South Africa question ade asan ba abetiti patient no. Inti me ha na patient by 2019. Now, but I'm so, oh, now, so we are referred, so we need to call. So you shouldn't worry because they say the aye. She's now a happy woman. She's saying, no, who here cross and crofobia to crying. Aqua breaches, some
hope.
Yes. Inti, dear Nabet Mia preventive stone formation. The only thing that will help us is DM. It's very necessary. Balanced diet.
Yes.
Then water. Ensuring the main advert, but vortic bottle kesiano. And yes, me advert but me church kesiano. Minimum very here say obenum in a day. That is minimum. And sachet water 6 minimum. But in form forming stones and so the air say you two more for say oda na wonya ne kra say bia okodwunso a sanu monsuo. So you are supposed to drink 24 hours. Yes. And you say you only drink when you are active, walking about. Yeah. But even if you wake up from sleep, you should always
hydrate a bit.
Yes, that's the most important thing. That is the only way by which you can stop forming stones.
Yes, that's so true.
And anybody at all who forms stones has another chance of forming a stone again.
Okay.
Yeah.
So you have to be careful.
You have to be very careful, especially once you form a stone. You have to be very careful.
Okay. I say prevention is better than cure.
One or castle.
Hey, your kidney who here? No, my emre and Cochesca Cassia. Munumunsu, me and Munsu. Nagana, Nakopodins what chain. Hey, Doc, thank you for coming on Vodafone.
You're welcome.
We'll be right back.
Afia, who's bet me your quenyas from ko aye nije ye power Vodafone so. Ye the data bundles are any seso Ghana ha bro. Ye more dia so. Ye ni da so nyina bem. Enti baka ye ho. Ya data mo ni je power bebre.
Vodafone, further together.
Today, in This Week in Medicine, we talk about something strange but fascinating: osteodontokeratoprosthesis, a mouthful. In simple terms, it means tooth and eye surgery. Indeed, this is fascinating. The eye is an integral part of our ability to perceive and appreciate our environment. However, several disease processes can plague the eye, rendering it inadequate, hence resulting in blindness. A unique form of artificial corneal surgery to restore vision of patients with severe end-stage corneal blindness, not amenable to any other form of corneal transplant, is the osteodontokeratoprosthesis. This was first published by Professor Benedetto Strampelli of San Camillo Hospital in Rome in 1963. It involved creating a support for an artificial cornea from the patient's own tooth and surrounding bone. Falsini modified the technique. He standardized it and reintroduced it into Britain in the mid-1990s as a modified osteodontokeratoprosthesis. This was carried out in 2 stages, 4 to 5 months apart, each lasting about 6 to 8 hours. Indeed, this was and is a laborious process. The good news is, various forms of transplants currently take place in Ghana to restore vision. Seek early medical attention if you are having problems with your sight. As I'm making there, actually, or Rome, doctors being professors be back together now. Okay, I wanna win with and I want to move why it's no done when you are on problem. Obey you once, honum baby. Na why you sin wage no son was a share in you no. Still obey sin was a share in you no. More bear and coffin obey and wotum will want the biom. Na, that ma at the sub began at the enye be, but say a problem or when you say a young boy. Or there bomodina call hospital, come eye doctor, no one share. A bohonuma at that all ma when your old friend. I think a crable hobo to my ear. Na when you are nankefra, near tomb, I shall not nanum, I shall umba, I wage you. This is all we have in This Week in Medicine.
Hello, it's me again. On today's episode, it's nothing rigorous. You better hear about me as stretching. Sometimes you have bread, you chi, you sissy, you have bread, you say, yeah, baby, I can't hear. And then you have barber stretching, so the baby release tension or your muscles more kaka. Until you start with way. A baby now. Now we go to joining kaka. No way leaning forward. As the we normally count 10. It's 2 kinds and as a draw, no sorry. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Niaba. Benwinemu. I don't know how far you could go, but just make sure say we Bionemu. There you go. Make me my 9 so kaka. Wait, a best stretch your hamstrings. Then you gently come back in this direction. What's answer for you? So 5, 4, 3, 2, 1. Niaba. You bring your legs closer. No, do not this direction. You go down. Now the elbow no. It be on enemy. Now watch us stay out. 5, 4, 3, 2, 1. Now you're out to this position. Now I'm on 9 is to say. Ebashara. Now I'm turning. It's okay, so I'll start to so movie kakra and yeah, share. It's okay. So you bring it down, take this leg up, then
Yeah, no about. Get your mat, lie on it. Next no 9. Never bako, a brassy. Chest out, very necessary. Sounds for our elbow. Then you do this. So 5, 4, 3, 2, 1. Turn to the other leg slowly. Same elbow. Push it back. We are no waba. We are stretching your cheek. See, ever lie down from the beginning. Now the sana koni say. No ama umuso. What's on swaba form? Repeating it 3 times. No ama umuso biyo. Last one. One who didn't know for question. Now that's no sense someone analysis say. Bring this one up. Same thing. Now the menu na bon. Now the abasho. Now so 9. What him say? So what me from be chwe? Na so udru hampa. So sir, every wa na on sa ain't me touch your toes. What me saw her and I saw hampo. I also wait to me at this new phone. Making sure say exercise near you now. We'll be any time. Until next time, it's bye for now.
Welcome to Jewels in the Kitchen with me, Frema, and net yeka in kitchen Huansen, aniseed. Yes, aniseed is sharp, but it packs a punch. And as usual, it is anti-inflammatory, of course. And what until I'm missing my selection, anti-inflammatory include my selection because a crumble on my own say a secret or inside. You might not even feel the pain, but a who's also. So taking things like this help, okay? So definitely anti-inflammatory. It is antifungal, it is antibacterial. And some research says that it does help fight stomach ulcers. Doesn't cure it all, but help. Remember what we say here. We are just helping the body to do its job, all right? And one interesting thing that came up was that it can also help reduce the symptoms of menopause. Yes, you heard it. It doesn't mean to cure menopause. Menopause is not something that is curing. It's part of the human body. It's part of the female process. It's like trying to say you cure menstruation. And see, but sometimes when they are going through menopause, they go through a lot. And taking aniseed or nkete as part of your regular diet can help you reduce some of those symptoms. Now that was my highlight because I know that our mothers and those going through really severe things when it comes to menopause, we've used diet to help them boost their estrogen levels. And it's good to know that nkete can also help.
When you're talking, first, I think there's a problem with my ears. I have to go in because first I heard honey seed. Is that what you're trying to say? Honey seed. Okay. Bofna.
A-N-I-S.
Bofna manse. Fantina meeting so nkete. I can't get and I make kai when you don't eat. When you don't eat during the day and in the night, the thing hold you. So that's what I was thinking. I thought you were talking about nkete like that.
And that one, is it anti-inflammatory?
No.
Oh, anti-inflammatory.
Oh no, you're pro-inflammatory.
So come on, you pro, indeed. It induces inflammation. Don't undermine the power of nkitty.
So I'm just clap because I'm very certain that there are people who also heard nkitty and referred it to it when I've experienced nkitty before. When I've experienced it before, then when they say nkitty, it strikes a chord.
Wait, I'm sorry.
You know, so for me, my highlights for this one was when Dr. Akpakli, right? Dr. Akpakli spoke about the stones, how they present, you know, the pain they can come with. And for me, I think when it comes to health, prevention is the key. You see, drink a lot of water. Try and avoid things that are going to sediment and crystallize it out. You know, you try to explain it very well. So I think that we should drink a lot of water. If you have any pain, you don't want to have, you see, I saw one of the stones that, Charlie, why they, remember one
3/4.
You see, so you're so huge. You don't want to have all of that because it can also lead to kidney failure.
Yes, he said
no,
that.
In soon, 30%. Actually, I say 30%. Monday, social media, on there. See, say, what's 30%? No, we are doing it. On the first, watch it show. What do you watch it show? What's he say? All back. Well, I send an apology letter to him yesterday. Remember back as 10%. Because he said 30 on the
Ghana make hot. Abba.
For me, I think I'll just zone in on the myth that we went through and focus on the fact that we all know that trying to use your safe period to prevent a pregnancy is the least effective method of contraception. Yes. So it's good to know it. It's good to know your body. But if you don't want to get pregnant, then you must take practical steps to prevent an unwanted pregnancy. Pregnancy is best when it is planned for, anticipated, and prepared for.
That's true. You know,
Ocho,
yes.
What is practical steps? I can hear somebody asking, Dr. Abba, what is practical steps?
Go to the family planning clinic. Speak to an experienced healthcare practitioner there and find the method that is most suitable.
Not your friend. Nancy, friend's advice, not your friend.
Not your friend.
Not your area champion.
And if you're feeling a bit shy, and you still don't want to talk to your friend and take Dr. KK's advice, which is true, actually, don't go talking to your friend, just call 255. Like I tell you, there are trained doctors there who can explain it to you better and help you come to that point where you are okay with yourself and you know your body well enough. It's been a pleasure. It's been amazing. It's going to continue to be amazing because we'll see you again next week. And bye for now.
Bye.
Vodafone, further together.